Today we're diving into a topic that is crucial if you are interested in a career in medical billing and coding, and that is certifications. There's a lot of organizations out there and the whole alphabet soup of different credentials, and you don't want to waste your time studying for a credential that's not going to get you the results that you want. So today I'm going to break down the medical billing and coding certifications. If you're new here, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, I highly encourage you to subscribe and hit the notification bell so you can get alerts when I post new episodes. Now, before we get into the talk about certifications, I need to tell you about today's sponsor, which is Preppy. You can find out more about Preppy at my medical coding masterclass at medicalcodingmasterclass.com. In the free career masterclass, I give you the full roadmap of how you get from someone with absolutely no healthcare experience to job ready as a medical biller and coder in as little as 6 months. It tells you everything you need to know about the career, what certifications to get, which we will talk about in this video, as well as things like job expectations, salary, outlook, and all of the essential information you need to know. It will also tell you about Preppy, which is the program that I fully endorse, and it checks off all of the boxes of everything you will need to know to start an amazing career in medical billing and coding. Again, the career masterclass is free and you can sign up today, medicalcodingmasterclass.com. So first off, why do certifications matter in this field? Why are they so important? Think of your certifications as your passport into the world of medical billing and coding. They demonstrate that you have a certain level of proficiency, that you're qualified, that you are up to date on industry standards. Unfortunately, a lot of employers don't have a lot of ways to gauge employee readiness in the medical billing and coding field, so that certification is a great first filter when they're looking for potential employees. Now, there's a lot of organizations and certifications to choose from, but first I want to break down for you the 4 types of medical coding. First, we have professional fee coding. That professional, when you hear professional fee or pro fee coding, doesn't mean like, oh, I'm a professional. It's talking about services that are rendered by physician and other healthcare providers. So it's about translating the medical documentation of providers and converting them into medical codes, ICD-10, CPT, HCPCS. This is what we usually associate with our Medicare Part B services, and we bill them out on the CMS 1500 form. And then we have outpatient coding. That is coding for a lot of our same-day surgery, emergency department, or outpatient clinics, and these are for services where the patient is not fully admitted into a hospital. And then we have inpatient coding, which is when the patient is fully admitted into the hospital. It's a little bit more complex and it involves ICD-10 PCS. I kind of consider inpatient coding like your facility fee or your room and board for using the hospital and all of the services and staff within the hospital. I guess kind of akin to like a resort fee for when you're at a hotel. And inpatient coding is usually associated with our Medicare Part A services, and we bill them out on the UB04 form. And then we have risk adjustment coding, which only involves ICD-10 CM. It's used a lot in our Medicare Advantage plans, and it does a lot of things like give bonuses to providers for providing good care or for taking care of really sick patients. It involves things like capturing all of the patient's complex diagnoses and accurately reflect their expected costs for that patient. And it helps provide information so that we can accurately predict future healthcare costs and make sure that everything is budgeted appropriately. Each of these different types of coding utilize different code sets, CPT, ICD-10-CM, HCPCS, ICD-10 PCS, and they all are very important within the healthcare realm. Now let's talk about certifying bodies, those organizations that you need to go to in order to get the credentials. Our heavy hitters in medical coding are AAPC and AHIMA. Those are our Coke and Pepsi. Those are our brand loyal ones that we know employers are looking for. Yes, there are other certifications out there. We'll talk about some of them, but if you are wanting a job in medical coding, trust me, AAPC or AHIMA, that's it. The most sought after medical coding credential is the CPC, and that's the Certified Professional Fee Coder. Again, coding for physician services. You'll hear it referred to also as pro fee coding. I recently did a search on Indeed.com for CPC. It brought up over 3,000 job results versus the AHIMA equivalent for professional fee coding, which is the CCSP, that only brought up 1,000 results. The COC is Certified Outpatient Coder. That's also through the AAPC. I wouldn't recommend the COC as a first credential unless you are already working in an outpatient setting where they need an outpatient coder. I have heard a handful of viewers telling me that they went for their COC first and then were really struggling finding a job with just the COC and then had to go back and get their CPC. Now the CRC is the Certified Risk Adjustment Coder, which is great if you love ICD-10-CM and you love working with diagnoses. It is a decent first credential, but most people get their CPC first and get their CRC. You will have a better chance at finding risk adjustment jobs if you're already working somewhere in healthcare. Then we have the CIC through the AAPC, which is the Certified Inpatient Coder. This is a newer credential. It's only been around for a few years, so not all employers recognize it versus the CCS through AHIMA. Traditionally, if you want to go into profi coding, you get certified through the AAPC. If you want to work in inpatient coding, you get certified with AHIMA. They have been treading though on each other's turf over the past few years. So a lot more employers are starting to accept the CIC, but traditionally we see that because it's just what's been on their recruitment forms and things for years, most inpatient coding positions, they're really looking for the CCS through AHIMA. So with the AHIMA certifications, the big ones are of course the CCS and the CCSP. CCS is inpatient, CCSP is for the provider or physician-based coding. They have some other advanced credentials like documentation improvement and things, but those are their main coding credentials. People will often ask me about the RHIT, RHIA. You do have to go through a accredited program through a college in order to even sit for the RHIT or RHIA versus the other credentials. You don't really have to have any certain prerequisites. You just need to be able to pass the exam. If you're interested in an RHIT, I will warn you that some employers still do not recognize that as a coding credential, so they may wind up making you take a coding credential in addition to having your RHIT. And for the RHIT, you need to have your associate's degree from an accredited AHIMA university. For the RHIA, you have to have your bachelor's degree from an accredited AHIMA university. There are other certifications out there for medical coding, but I'm telling you, people want AAPC and AHIMA. I know there's some organizations that they have like a deal with certain colleges and universities or training schools that they'll say, hey, when your students are done, we'll give them a deal on sitting for this certification, but the people that sit for a lot of those type of certifications are always in my comments saying they were worthless, they didn't get any jobs with them, the employers weren't looking for them, and then they had to go and get credentials with AAPC or AHIMA. So not saying they're not good credentials and great organizations, but as far as if you are looking for a job, which most people are, you're gonna want those AAPC or AHIMA credentials. If this is too much for you and you're like, I don't know, Victoria, I just wanna work in medical coding, CPC, my friend. That is your probably best default. Now the AAPC has all of these core credentials like the CPC, the CRC, even the CPB, which is for billing, but what about those specialty credentials? The AAPC has different specialty credentials, so if you want to get specialized in coding for dermatology, general surgery, cardiology, you can demonstrate your proficiency and get certified in those specialties. Again, these are more suited for someone who is already working in that particular specialty or just wants to demonstrate their proficiency in coding that certain specialty. They're really not great first credentials. You can sit for any credential with the AAPC in any order you want. You don't have to get like a CPC first and then get certified in cardiology. However, if you don't have that good foundation first and you're just like, I only want to work in coding for urology, you're going to really narrow your scope of jobs that you're going to be able to find. And if you can't find anything in urology, you can't just take your urology coding certification and go get a job in inpatient coding. It's fine to have a specialty in mind that you'd really like to work at, but you need to keep an open mind and have a good general foundation of all things billing and coding. Otherwise, you may have a really tough time finding a job. AHIMA does have micro-credentials. I did a whole video up there about the micro-credentials. AAPC is coming up with, I guess, some sort of similar specialty proficiency assessments. We'll kind of see how that goes. Now, there are other pertinent certifications that I think are good. The CRCR is growing in great popularity for people who work in revenue cycle. They want to demonstrate proficiency in the revenue cycle, especially if they're in a management or a financial sort of aspect. CHC is certified in healthcare compliance. That is from the Healthcare Compliance Association, and it's often used for compliance professionals. The AAPC does have an equivalent credential, the CPCO. So if you want to go specifically into compliance aspects, those are some certifications you can look for, or if you're a coder who's looking to make the jump over to compliance. So in conclusion, those certifications are really your golden ticket into the world of medical billing and coding and the whole healthcare revenue cycle. They show that you are dedicated, they show that you are knowledgeable, and they show that you are ready to excel in this field. So, do you have any certifications that really helped you out in finding a medical billing and coding job? Or do you have some certifications that you think absolutely do not hold water, do not waste your time on them? I need to know. Definitely let me know in the comments below. Otherwise, I will see you guys in the next video, and until then, just keep on coding on.